First of all, I thank that you have invited me to come over here. So I express my sincere gratitude for providing me the opportunity to speak before this August gathering with the vision of One Earth, One Health. Our beloved Prime Minister, Sri Narendra Modi ji, has clearly spelled out our undiluted commitment to his approach by saying that we have put forward a vision before the world, One Earth, One Health. This involves holistic health care for all creatures, humans, animals, or plants. This approach will help to prevent diseases, reduce costs, improve food security, and save life. We have always thought of global well-being in all our activities through our ancient philosophy, Vasudeva Kutumbakam. Tripura is one of the smallest states of India, situated at the northeast region of India. Tripura has long shared border with Bangladesh. Large number of people of Bangladesh use these health facilities available in Tripura. Tripura has also undertaken a transformative approach in its healthcare system. Tripura has 2 medical colleges, and recently we have set up one government dental college, and we have one veterinary college, agriculture college, fisheries college, etc. We have proposed a setting up of one AIMS and another AIMS-like institution in Tripura. If world-class treatment facilities are set up in our state with access to the people of Bangladesh, it will be of great help for the people of Bangladesh to receive affordable treatment. There is very good scope for integration of Ayush with modern medicines in the management of different style disease for which there is great demand for the people of Bangladesh. Setting up of world-class integrated border multi-speciality hospital may be explored in Tripura. Since the connectivity would be established after opening of Montri Setu at Sabrum, South Tripura, it would be the gateway of Southeast Asia region. Therefore, an establishment of an international school of Ayurveda and Yoga and may open many endeavors of business opportunity for the world. There are plenty of medicinal plants and herbs in the state of Tripura. The climate and geographical of the state with hills and valleys are very much suitable for plantation of medicinal herbs in our land. Therefore, for optimum utilization of these resources, a manufacturing unit of Ayurvedic medicine may be established in Tripura. I heartily welcome the world to explore my state and use the existing as well as upcoming facilities as we all believe in welfare of mankind as a whole. I extend my sincere thanks to you all. Thank you very much. Jai Hind.
Thank you, Honorable Chief Minister, sir, for your keynote guidance. I would now like to invite Shri Prem Singh Tamang, Honorable Chief Minister, State Government of Sikkim, for his keynote address, please.